I'm an orthopedic consultant and a robotic joint replacement specialist. I practice in Navi Mumbai. We all have been excellently trained into conventional knee replacement surgeries, but conventional knee replacement surgeries are definitely human dependent. When they do the surgery, the human eye error, human hand error, or human emotional effects on the surgery, these are the factors which have not been taken care of till this point of time. So according to me, the human hand error can be negated by the robotic hand precision and the the importance of artificial intelligence in the robotics. With the help of that artificial intelligence, we can plan it better, and the robotic hand can give us a precise cut. So definitely the robotics will help in human carpentry, which is like joint replacement surgery. Dependent basically on the alignment in which these implants they have been put. So in conventional knee replacement surgery, your hip and your ankle, they are not seen to the naked eye. So you have to assume them, and accordingly you have to put the implants. But in case of robotic knee replacement surgery, you are doing CT scan in an image-based system. You are doing hip, knee to the ankle CT scan. You are planning the alignment perfectly, and with the precision of less than 1 degree and 1 millimeter, you are putting those implants. You are planning those implants initially, and with the help of robotic hand, you are putting them inside with the precision. So definitely that is going to cause a better alignment, and maybe patient-specific alignment. The results are going to be amazing. With the better results and better alignment, definitely the longevity of the implant will be best. And with the best longevity of the implants, the revision rates will come down.